They called it perfect rhythm, a pill so precise it could correct the heartbeat to the exact measure of a metronome. No more skipped beats, no more danger, no more dying suddenly in parking lots or restaurants. After decades of watching patients collapse from heart failure, medicine finally had the cure that worked too perfectly. So perfectly that it did not let anyone live long enough to thank it. In the late 1970s, cardiology faced a haunting paradox. People were surviving heart attacks more often, but many died weeks later from erratic electrical surges in damaged hearts. The solution seemed logical. If you could suppress the premature spikes that fluttered through injured tissue, you could silence death itself. Drug companies designed a class of compounds called antiarrhythmics, molecules that made cardiac cells less excitable. To doctors, they sounded like magic. Control the current, control life. The most promising of these were encainide and flecainide, clean white powders capable of erasing every abnormal flicker on an electrocardiogram. In lab animals, their precision was surgical. Chaotic heartbeat transformed into stable line within minutes. In volunteers, the result looked biblical. Electrodes drew graphs smooth as silk. A generation of physicians watched those lines and believed they had tamed electricity itself. By 1985, these drugs had become post-heart attack standard care across America. Journal ads depicted strong men jogging, slogans whispering, "Your heart deserves perfect rhythm." Nobody asked whether the drawings on paper matched the meaning of life in a living chest. Numbers were small, studies short, optimism infinite. Then small murmurs began filtering through emergency wards. Some patients returning for follow-ups were worse, not better, fainting, seizing, dying without warning. Their ECGs right before death looked flawless. The curve was normal to the final second, then flat. The cure worked exactly as intended until the instant it killed. It took nearly a decade before anyone proved it. In 1989, researchers launched the Cardiac Arrhythmia Suppression Trial, known as CAST. It was meant to silence critics by producing definitive evidence of benefit. Instead, it exposed a catastrophe. Halfway through, statisticians demanded the trial stop. The mortality rate among patients taking encainide or flecainide was 3 times higher than those on placebo. The very drugs engineered to prevent sudden death were causing it. The mechanism was cruel irony. They so effectively stabilized minor rhythm changes that they also blocked the heart's emergency flexibility. Under stress, the muscle couldn't adapt. The next major arrhythmia simply never corrected. The chemical shield became a locked door. Medical journals called it the most sobering result of modern cardiology. Within months, the pills vanished from pharmacy shelves. Within years, they reappeared, repurposed cautiously for rare cases. But for the thousands already prescribed, realization came too late. The lines on hospital monitors were perfect right up to the end. No one intended murder. It was mathematics in good faith gone bad. Researchers had relied on surrogate markers, visible ECG improvement as a proxy for long-term survival. They never made it to the finish line because the optics looked so convincing halfway through. In science, elegant results are seduction. They hypnotize intelligent people faster than money ever could. CAST became every medical student's parable. Never let beauty outvote evidence. The aftermath rewired clinical research. Regulators demanded hard endpoints, real survival data, not symbolic ones. Today that rule saves lives quietly everywhere, but it was written in the handwriting of those who died flawlessly. Medicine moved on, as it always does, toward the next perfection. In the 1990s, the pendulum swung from electric correction to biochemical control. Cholesterol, blood sugar, blood pressure. New statins and glucose regulators arrived as miracles of modern synthesis, astonishingly effective at sculpting laboratory numbers. The cure works. Again. But the more numbers flattened to textbook ranges, the less clinicians liked what they saw in patients' eyes. Fatigue, muscle breakdown, liver strain, hearts pumping within margins too narrow for chaos. The same lesson re-emerged under new branding. A system built for balance doesn't forgive precision for long. And yet, humanity keeps chasing it. The idea of a compound that runs life perfectly tempts both sides of the stethoscope. Doctors crave order, patients crave safety. The marriage breeds hubris. When precision meets flesh, error hides not in failure but in success. Other fields copied the cardiac dream. In oncology came angiogenesis inhibitors, therapies that starve tumors by cutting their blood supply. On scans, cancers shrank spectacularly. Headlines cheered victory. Soon afterwards, physicians noticed patients dying from brain clots and heart attacks, the same blockage technique working too well in normal vessels. The message repeated in whispers across departments. Perfection is incompatible with survival. For context, dig back to the 1930s fever therapies. Julius Wagner-Jaureg's AS malaria treatment for syphilis succeeded brilliantly, so brilliantly that clinicians kept using it even as safer antibiotics arrived. They couldn't bear to abandon a perfect cure. By the time penicillin made the infection trivial, thousands of patients had died from intentional malarial fevers. History forgave, then forgot. Every century reinvents the idea that flawless function leads to redemption. A bell curve obsession measured in lab values. Heart rhythm, sugar, cholesterol, serotonin, pick the molecule, aim for symmetry, declare victory. And when the body's natural noise returns, we up-titrate the dose. Progress, 1 decimal deeper. In psychology labs of the 2000s, serotonin reuptake inhibitors followed the same seduction. Smooth out human emotion by raising baseline mood chemistry. For most, they worked beautifully. For others, same paradox. Emotions calmed until they disappeared, taking empathy with them. Medicine improved the waveform of mood exactly until it erased personality. Different organ, same sin. Doctors hate randomness. Nature loves it. Every heartbeat, every neuron fires with microscopic imperfection. The noise is the signature of life. Remove it, and systems seize. When we invented antiarrhythmics, we edited out chaos itself, the tiny dissonances that let the heart improvise. It's like muting the jazz section of biology. Encanide and flecainide became cautionary tales told in residency corridors. Never trust a perfect rhythm. But outside the classroom, the industry adapted the moral cosmetically. Brochures now sell targeted, balanced, personalized, perfection renamed, but never expelled. Physicians who lived through CAST describe how disbelief felt physical. I remember running the numbers 3 times, one cardiologist said later, because humans simply don't die from normal ECGs. But they did. 9,000 excess deaths estimated before withdrawal. 9,000 proofs that medicine's most dangerous symptom is success itself. The social autopsy spread beyond hospitals into philosophy. Novelist Don DeLillo once wrote, "When the cure works too well, you lose what you came to save." The quote hangs in some cardiology offices beside framed ECGs. Lines that look tranquil, almost artistic, signed by loss. In a positive twist, gene therapy, cell editing, and AI diagnostics all learned from the rhythm disaster without knowing it. Trials slowed down. Adaptive monitoring replaced blind escalation. But perfection always re-enters through side doors. Algorithms now declare predicted survival curves to the decimal. Perfect again, until proven fatal in new ways. Machines don't crave beauty. They just replicate our appetite for it. If you zoom far enough out, you realize every medical triumph balances between control and surrender. Too little and we die from nature. Too much and we die from ourselves. Somewhere between those extremes, life's health. A chaotic equilibrium the human mind finds intolerable because it can't be perfected, only lived. That's why these stories repeat. The cure that worked too perfectly to let you live isn't just a chemical, it's a reflex. Every technology eventually mirrors its creator's psychology. We dream of precision because we fear randomness. We kill randomness and discover it was keeping us alive. Walk into any intensive care unit tonight and you'll see monitors replicating the exact mistake of half a century ago. Green lines hovering at textbook parameters. Nurses adjusting drips to achieve perfection pixel by pixel. Somewhere among them, one monitor will flatline unexpectedly. The first reaction isn't grief, but confusion. It was perfect. The modern descendants of those heart drugs still circulate under new names, tamer analogs, lower doses. Their warnings now list pro-arrhythmic potential, legal code for may cause the very disease it treats. Somewhere a patient signs the consent form, numb to irony, because every signature is a declaration of faith that we've outgrown catastrophe. That faith is how catastrophe breeds. In ethics panels, scientists like to reassure each other with probability math. 1 in 1,000 serious events, well within acceptable safety margins. 9,000 deaths later, the same ratio survives unchanged, just re-averaged across new ambitions. Humanity treats numbers like antibiotics. Take enough, and the guilt disappears. But there's another way to read perfection, as confession. The true boundary of compassion isn't how much pain we can end, but how much imperfection we can tolerate. The people who swallowed those tablets gave us data more valuable than any ECG. Proof that chaos is intrinsic to existence. Smooth lines kill. Noise keeps rhythm. If you could resurrect one of those patients and show them the legacy of their deaths, thousands saved from repeating the error, they'd likely forgive us. Maybe they'd even smile, ironic, at how beautiful their final heartbeats looked on paper. And somewhere, tonight, another researcher sits watching another flawless graph climb on the screen. Heartbeat stable, biomarkers perfect, grant funding pending, certainty intoxicating. He leans closer, mesmerized by order, unaware that perfection has already started whispering its old promise. This time, it will only heal. The technology exists, the warnings exist. What's missing is the humility to accept noise as life itself. Because the most haunting truth about the cure that worked too perfectly to let you live isn't that it happened once. It is that the pursuit never ends. We still measure success in symmetric lines, still equate silence with safety, still erase the small irregularities that prove we're alive. If this story unsettles you, hold on to that pulse of unease. It means your chaos is intact. Share it, before the next miracle smooths it away.